expect. We are excited to safely welcome students back for in-person learning for the 2021-22 school year. However, we do know that some families may want to continue with remote learning. And so to best support these students, we are offering an online option for families to enroll in remote learning for students in grades K through 12. The window to select remote learning runs from Monday, May 10th through Friday, June 4th. Here today to answer your questions are Tamara Acevedo, Deputy Superintendent of Academics, who can provide more information about both in-person and remote instruction. Michael Ramirez, Deputy Superintendent of Schools, who can provide answers to your questions about our health and safety protocols as well as school plans for the coming year. And also Dr. Stephen Federico, Director of General Pediatrics at Denver Health, who can speak to the current health conditions and trends, and of course, vaccines for students. So with that, we will go ahead and open it up for questions. Seth at the Gazette, go ahead.
Thanks. What do some of the COVID plans for next year entail as far as for in-person learning, continuing health measures, quarantine? What are some of the plans in place for next year? Just in terms of like health response. Thanks.
I guess that would be mine, huh? It's a great question. Everybody wants to know the crystal ball throughout the pandemic, what's coming next. And on the first week of May, to think about the second week of August, it's a little bit hard to predict, but with where we're headed based on vaccination rates in our community and the current trends in terms of community spread, I think we're very optimistic in the health community that amongst our adolescent population, especially, we're going to have schools that look a lot more like schools did before the pandemic. This is completely predicated on how quickly our community gets adolescents vaccinated and the families of our adolescent population vaccinated. We're very excited that the FDA is likely to approve the COVID vaccine for 12 to 15-year-olds early next week. We're already at 40% of our 16 and 17-year-olds in Denver County receiving at least one dose of the COVID vaccine. So if we're around 50% of our adolescent population being vaccinated as we get close to the school year, that's dramatically going to decrease the risk of COVID in our schools. In terms of which of the mitigation measures we will not be incorporating next school year, I think that remains to be seen. What we've said repeatedly is that masking will be the last thing to go. So other than that, the other mitigation measures that we use around spacing and checking for symptoms beforehand, those have a real possibility of being adjusted before August.
Yeah, and I'll just add on to that as a district, connected to what Winna was saying earlier, as we're planning for next year, we're anticipating that students of all ages will participate in a regular schedule, full-time, in-person learning Monday through Friday. And it'll look much more like it has in the past.
I think the one thing that I'll add, thank you, Doc and Tamara, is around the protocols around students coming into school. We're still working through what those look like. As Dr. Federico mentioned, I know the 3-foot distancing within classrooms has created some challenges to be able to actually have that just because of spacing. So that's ongoing conversation that literally weekly we're having conversation to get to a place that, as Ms. Acevedo mentioned, gets closer to a regular school day of 5 days a week for students. But some of the checks and some of those pieces are going to be, but the vaccines are going to play a big role in that process, particularly around when we talk about quarantining and what expectations or what the rules will be around that.
Thanks all. Jackie, CBS, go ahead.
Oh, just my question was, if you can take us through what would the vaccination requirements be? Like, how do you prove that you've taken the vaccinations? When does that happen? If you can let us know about that. For those that are eligible, of course.
Are you asking from a district perspective, how will we gather data about who's been vaccinated at the individual level?
How would you determine who, I mean, I think you're asking that students be vaccinated. So for those that can get the vaccination, is it just at registration, just to prove that they have taken the steps and did get their shots?
Well, to be clear, I mean, I think a lot of what we'll be able to do will be dictated by county level data in terms of knowing what the community's vaccination rate is. And that's publicly available through the way the state collects vaccination data. Whether or not we'll be doing adjustments within the district or school level, I think that remains to be seen. Those data are not currently collected.
Great, thank you. Teeny with the Denver Post, go ahead.
Sure. Just to be clear, so, schools require a lot of vaccinations prior to being able to attend. So the COVID-19 vaccine will or will not be one of those?
Yeah, I would say at this point, that has not been determined, that vaccine is going to be something that's required at this point. Now, what conversation, as Dr. Pacheco mentioned, as we move along in the summertime, if those decisions change, but at this point, that's not one that is going to be there's been no determination of that being required at this point.
Okay, great. Now, DPS forewent giving F grades this year, instead issuing incompletes. Is that something that you expect might stick around?
Yes, it is something that we expect might continue, as we, really are focused on our students being able to learn in the best way possible. And our overall goal in Denver Public Schools is that our students go on to graduate, and they do that. They're able to meet their goals in higher ed. And you can only do that if they're able to achieve true competency within the courses that they're taking. So our goal is, that they are able to thrive in their courses and achieve competency. And if they have an incomplete and are able to then turn that into a competent score in the class, that's the ultimate goal. We want to see them succeed, not fail.
Any other academic changes from this COVID year that you think will stick around long term?
I think we've had, I know we've had a real focus on what are essential pieces in each grade level that are critical for us to plan for and make sure that students are achieving in them. And so we've done work to our scope and sequence documents, so our scope and sequence of learning for each grade level, for teachers to be able to know where to assess in those critical areas so that they can plan instruction differently for any losses in teaching. And so that'll continue to happen. We'll continue to support in that way. Also, additionally, we are doing work right now to sort of re-envision what education will look like in the 21-22 school year. So we've got things that we're looking at, like in terms of technology and remote learning. So what were the things that really worked out well? The use of a learning management system, the way in which we've worked on some of our credit recovery systems and really narrowing the focus there. So some of those things will definitely stay on and stick.
Nicole at Denver 7, go ahead.
Yeah, I'm going to jump on that question about the remote learning plan for next year. I understand next week the enrollment for that will open up. Families can start deciding if they want to put elementary students in that, and then high school, I think it might be a centrally based Denver online program, it sounds like. Can you talk about some of the changes that are being planned? And based on what I've heard from another district, Jeffco, they had fewer signups than maybe they thought for this. So is DPS expecting a lot of families to sign up for remote learning next year? And then how are they going to make that a quality program and provide all the services to kids through that remote program?
Yeah, I'll thank you for that question. I'll start, and then maybe Tamara will tag team with me on that. But I would say, when we did preliminary data, the numbers did reflect, larger numbers of the potential of parents wanting to have students sign up for the virtual option. The however is, we know a lot more now. That was just 3-4 weeks ago. So I think that this window now that opens up on May 10th to really look at what does that number look like. We're going to know more in the coming week or two around what those numbers actually are. As you mentioned, the alignment around Denver Online for the 612 platform to really look at how we do and how we can support centrally students and families in the virtual space is something we currently are working on. Also looking at, and when we look at elementary students, very similarly, kind of if you want to just for just a visual, the expansion of what would be a Denver Online, but there'd be more of a targeted approach with elementary. So we know that. I'll also share, the data's been clear around, trying to encourage our earliest learners to be in school, knowing that some of the challenges around the virtual programming for our, youngest learners as well. So just trying to find that right balance and doing as much education with parents so they can make the best informed decision around what their educational experience would be for their child. But we are currently working to lift that program up. Expansion of Denver Online, from through the grades that currently don't exist, which is middle school and elementary as well. Tamara, I don't know if you would add anything to that.
No, unless there's a follow-up question on that.
No, thank you.
Emil with Univision, go ahead.
Thank you. The question is in Spanish. Ahora que vuelven más estudiantes a las aulas de forma presencial, ¿qué pasaría si se presenta un nuevo brote de coronavirus entre los estudiantes?
Gracias, Emil, por la pregunta. Vamos a seguir viendo casos de COVID en agosto, septiembre y durante el otoño. Esperamos ver casos en el futuro hasta que llegamos a un punto donde se ha vacunado la mayoría de la población, y obviamente, como en el momento solo se pueden vacunar los 16 para arriba, pronto incluyendo los de 12 a 15, pero los de la infancia hacia la edad de 11, no creemos que vamos a tener la oportunidad de vacunarlos hasta tal vez los finales de este año. Entonces, en el otoño, en los grados de primaria, vamos a tener varios alumnos que no están vacunados. Además que en la población, los adultos que escogen no vacunarse, vamos a seguir viendo por lo menos un basis de casos. Entonces vamos a tener que seguir un plan de salud público de cómo vamos a manejar esos casos. Pienso con el riesgo del COVID al nivel de la población que se haya bajado, por ejemplo, en la gente mayores de 60, hemos visto menos casos internados, menos gente se ha morido. Entonces, al nivel de la población, el riesgo del COVID se está disminuyendo mes por mes. So, es probable que vamos a manejarlo de una manera muy diferente en el otoño. Exactamente cómo, todavía no se sabe. Pero, por ejemplo, según la cuarentena, es posible que esa recomendación se va a ver muy diferente en agosto de cómo se ve en el momento. Al nivel del salón o al nivel de la familia todavía no sabemos. Pero todo depende en la rapidez con cual se vacuna la población.
Gracias.
Thank you. Ginny at CPR, go ahead.
Yes, thank you. This might be for the doctor. I think it's confusing to some in the public, the reticence to require a vaccination for a virus that's so contagious and dangerous. And this is a follow-up to teenies. So schools require hepatitis B, diphtheria, tetanus, D, IPV, rubella, measles. I'm wondering if you could explain the criteria through which it's been determined that their students need vaccinations for those, and would a similar criteria be used when school officials and medical officials go about determining whether or not to require a COVID vaccine?
Yeah, thank you, Jenny. I think it's a great question. You know, given the massive public health impact of this virus, I think you will see increasingly different governing bodies begin to explore this question of a vaccine mandate, and I think COVID vaccine will be a part of that discussion moving forward. I cannot say what the process will be like. I think that you've seen this in higher education. You've seen different university settings, including the University of Colorado, move in that direction. I think that we will continue to see different organizations move in that direction. Healthcare facilities, potentially public education. I think that will be a big topic of conversation over the next 3 to 6 months.
Thank you. Noel with 9 News, go ahead.
Yeah, just a question. If you're not going to be requiring the vaccine, is DPS going to have any role in hosting or supporting vaccination clinics that could be hosted at schools or, you know, DPS property, just to obviously bring in, you're recommending the vaccine, but what other what else are you doing to ensure that folks, especially 12 to 15-year-olds, when that opens up, people are vaccinated? Thanks.
Yeah, thanks, Noah. It's a great question. Denver Health and DPS are really proud of their partnership, and we've been leading the way, not just locally, but nationally in terms of trying to create a model for how we would do site-based mass vaccination clinics. We've already hosted the last 3 weekends vaccination clinics for not only our 16, 17, and 18-year-old students who are currently eligible, but for their families as well. Because of the way the virus spreads, you know, just vaccinating our students isn't enough. We want to vaccinate the entire community, the entire family. And DPS has been a leader alongside Denver Health with providing these vaccination clinics. We've done thousands of vaccines to date. We have another 3 weekends planned, another 6 vaccination events. And as soon as the 12 and 15-year-olds are eligible, deemed eligible by the FDA, they'll be included in these vaccination clinics. We are currently working on a plan to do another 10 vaccination clinics throughout the month of June at different school-based sites. And school-based, of course, using the schools are a great strategy for doing vaccination because they're out in the community. We eliminate a lot of logistical barriers for our families. And so we're excited to continue to partner to take vaccines to our students.
Jackie at CBS, go ahead.
Yeah, you know, we're just trying to learn what it might look like in the new year. And one of the things that you had said made me think about changes. So one is, you know, is it clear if state testing will return yet? But in that same vein, thinking about things that might look like what they used to, what about those extracurriculars? You know, any changes or rules there? So kind of a double question there. Thank you.
So the first question was on state testing, correct? Yeah, right now, so no, I mean, we've been getting updates from the state and on weekly calls in terms of direction and policy connected to what's happening in the state. We also have members of our assessment team that have been directly working with and hearing from the state. We don't have direction right now on what that will look like for next year. So, but we'll stay tightly tuned in to that. And they certainly, the Colorado Department of Education have been really good partners in working with us on plans moving forward.
On the extracurricular side, we've been working really closely with the doctors around just trying to ensure that extracurriculars are happening for our students, particularly outside, and just trying to, so as we look at going into the fall of next school year, we want to continue to not only offer, but to expand, you know, what is possible and the opportunities. There'll be further conversation with CHASA when we look at athletic activities and maybe spectators and things of that nature. But we certainly want to, as we talk about getting back to some level of normalcy, want to honor all extracurricular activities and do everything we can to continue to provide all of those opportunities. But we will continue to lean in with our doctors and with Denver Health around what is safe. And we have weekly calls, and extracurriculars and those opportunities continue to be at top of mind, because we know how important they are to keep our students engaged in school.
Thanks, Mike. Nicole, Denver 7, go ahead.
Yes, I think I saw that the Denver Summer Academy is already full, and that was going to focus on some kids with some needs for reading help and English language learners. Are there any plans to offer any additional summer school programming through DPS? Any changes to what normally would be offered for credit recovery this year, and any, you know, anything that you guys are using any of these additional federal funds for, perhaps to accelerate learning or offer additional tutoring to catch kids up if they fell behind?
Yeah, thank you for that question. We do what you mentioned in terms of summer programming. Summer Academy is definitely part of our programming, and we're continuing to monitor that. And with enrollment, you know, we want to ensure that everybody that needs that opportunity has a chance to be part of that. So Summer Academy, which is really working with our literacy skills, our foundational literacy skills we have. We also are having summer programming with Ready Scholars. So it's for rising kindergarten students, which was really working also on enrichment. We've got connected to that, we've got enrichment programs in collaboration with some of our extended learning partners, such as the Boys and Girls Club and Summer Scholars. And also Discovery Link has been a huge partner as well. We are also looking at opportunities in the summer, and we have available opportunities for our transition grades. So 6th grade academy, 9th grade academy, and then another opportunity with Generation Teach, where we're focusing on for secondary social emotional learning, and again, academic enrichment. You mentioned credit recovery. We also we are continuing to offer credit recovery, but we have made changes to credit recovery offerings. I talked a little bit about that earlier, where we're narrowing the focus on the areas and looking at the individual students so that where they can focus on the areas that they need most within a course. With the opportunity to take on more that way. So that's for this summer. Then right now we just finished a design group that's looking at summer schools specifically with ideas that we're going to work on for next year to build out a multi-year strategy for how summer school will change. So some of that, we're going to be doing some piloting of individual summer school programs at individual school sites.
Thank you.
Thanks, Tamara. Teeny with the Post, go ahead.
Yeah, hi. So I know that the jury's kind of out on what protocols might be in place next semester, but recently 12 superintendents sent a letter to CDPHE hoping they would discontinue student quarantines for the remainder of the spring. I want to know from the operational side how quarantines are affecting daily operations, and then from the health side, Dr. Federico, do you think that's a good idea given that cases continue to rise among younger demographics?
Yeah, I'll take the quarantine piece. The simple answer is they've been affecting the operational pieces, and it becomes a challenge to really be able to, because of that disruption, right? A lot of it has been just around trying to keep some, normalcy, stability for students coming to school. So the quarantine piece has, it does impact, and it has been impacting, on the operational side. Our teams have been doing an incredible job, and our school leaders to just manage that and trying to keep that disruption to a minimum. And, we've looked at strategies around seating charts and different things that can help mitigate the number of students that need to be quarantined. And we also continue to reiterate the DPS 5 around our health and safety protocols within our schools to try to minimize, a lot of the things that come into play when we look at the quarantine piece. So that's what I would share around the quarantine. But, and obviously I'll let Dr. Federico share on the health side.
Great question, Tini, and certainly timely. What we have seen consistently throughout the pandemic is that when we follow the mitigation measures that are in place, recommended by the CDC, what we call the DPS 5, schools are safe. There is very limited transmission within schools. That the rates that you discuss about seeing increased rates amongst kids has everything to do with spread in the community. Now, the question about whether or not those data support a change in the quarantine policy at this moment in time is really a question for the state. It's really a question for CDPHE. At this point, CDPHE continues to recommend that when you have 2 cases within 14 days in the same cohort of kids, that you quarantine. And that's the policy we've been following at DPS. I do think it is a fair time to look at the data of transmission in schools at the level of the state and to see if that policy needs to be changed. But from a DPS perspective, we're going to continue to follow CDPHE guidelines for the rest of the school year.
Okay, thank you. Yeah, the folks at Jeffco Public Health or Tri-County Public Health had closed down several high schools and middle schools in Douglas County School District because they believed that transmission was happening within schools. So your opinion or your observation is that transmission remains low still within schools and extracurriculars?
Yeah, so transmission definitely happens everywhere, but school is a place where transmission happens less often than in other settings because of the mitigation measures that are in place. I will say that the recent school closures have prompted the state to adopt some alternate strategies within quarantine and to look at strategies around testing to allow kids to come back within that quarantine phase if they test negative within a certain time frame. The other variable that's changed at the high school level is vaccination. So if you are fully vaccinated and fully immune 10 days past your second dose, then you no longer need to quarantine by state guidelines. That population within schools continues to grow as vaccines become available to student-aged adolescents. So that, of course, will begin to change the quarantine guidelines as well if we achieve a high vaccination rate within a certain age range.
Thank you. I'm not sure who at CBS, but I see a question. Go ahead.
It's me, Jacqueline Quinn. I'm sorry, I don't know why it doesn't say my name on there, but the governor has talked about trying to reach a certain percentage to get herd immunity. And I wonder if there's also just a number in DPS that is a goal you guys are trying to reach as well.
I would say we haven't identified a specific goal, but we are trying to maximize and get as many students, to be vaccinated. So as the vaccine becomes more readily available, we're going to continue to have that push to really try to get that, because we understand the significance to getting this under control by having the number of not only students but adults in our community vaccinated. So we haven't set an exact target at this point, but just to continue to maximize the number of students that would get the vaccine.
Thank you. And a follow-up from Nicole at 7. Go ahead.
Yeah, and I just, Dr. Federico said this at the beginning, but I wanted to make sure I had it accurate. Did you say 40% of 16 to 18-year-olds in Denver have received a first dose of the vaccine at this point, or was it 16 and over, so therefore including adults? I wasn't sure.
40% of 16 and 17-year-olds in Denver County have received at least 1 dose.
Thank you.
Okay, I think that's it. If you have any last minute questions, let me know. Okay, this meeting is recorded, so I'll make that available to you guys on the website. Thank you again for coming. Appreciate it.